Hello, and thanks for tuning in. Lameness is a huge subject, but let's look at the common causes in donkeys, and much of what I say applies to horses and mules too. And just bear in mind that lameness nearly always means pain. So it's really important to get a diagnosis and effective treatment plan without delay. Bear in mind too the stoic nature of donkeys. So we need to be extra vigilant in looking for any abnormal signs that may be less apparent than in horses, who tend to like to tell us exactly where the pain is and just how bad it is. 90% of lameness is said to be hoof related, but that means that 10% of lameness is not. So please don't hesitate to get your vet involved at an early stage of lameness. Now, one design fault in the donkey that puts him at high risk is the fact he walks on just one toe or digit. Compare this with a cow, for example. She has 2 digits, so if one goes horribly wrong, it can be amputated, and the cow can manage to walk comfortably on the remaining digit. The donkey with a foot that cannot be repaired to restore a pain-free life simply should not be expected to go on. I know it's heartbreaking to be talking about euthanasia because of just one foot, although of course it could be more than that, but it's a fact. If you want more information about donkey anatomy and lots of other topics, do check out the short talks on the Safe Haven for Donkeys website under Help and Advice. As part of your general all-over check of your donkeys, do check for symmetry. Both front legs and both back legs should be a matching pair. Can you see that the hooves in the picture on the left are not identical? Hooves are made of very hard material, but they are actually quite dynamic, and the hoof will tend to shrink if it's not used. So if you see one hoof bigger than the other, the chances are that the larger hoof is taking more than its fair share of weight as the donkey attempts to reduce the load on the painful limb. Check for any joints that look bigger than their counterpart. Here the left hock joint is swollen. That could point to inflammation, infection, or arthritis. The fluid could be the joint fluid, blood, even pus. So it's really important to get your vet on the case quickly. And have a feel to make sure no joints are warmer than the others. Now, the best way to check for lameness is to watch your donkey moving. All of you who have horses will know that it's pretty standard to both walk and trot the horse up and down in a line to check for any sign of lameness. In an ideal world, we'd do the same for donkeys. However, in my experience, asking a donkey to trot doesn't get much further than the request. All talk, no action. Many donkeys simply will not trot to order, although I appreciate that many of you have active donkeys, which is absolutely great. In any event, you can still observe lameness at the walk. This is quite an extreme case of forelimb lameness, a mule working in an Egyptian brick kiln, but it's a good example of a head lift which you should look for to determine which front limb is painful. The head is raised when the painful limb weight bears. Again, an extreme case, but for hind limb lameness, look for the rump lift and the head nod. The hind quarter on the painful side will lift and the head lower as the foot hits the ground. Of course, it's entirely possible that your donkey could be lame on more than one limb. Look for a shorter than normal stride as the donkey attempts to keep the weight off all the affected limbs. And the sensible donkey may simply plant or lie down, as walking is just too painful. So let's have a look at the more common causes of lameness. Hoof abscesses are all too common, as is laminitis and arthritis. The other conditions are less common. Just regarding fractures, these may be very obvious with a limb literally swinging, whereas a fractured toe bone can just result in more of an abscess-like lameness. A nerve damage can lead to a limb that is just hanging limply. I have seen a dislocated hip in a young donkey that had been playing violently with his friend. Get your vet involved right away with any dramatic lameness. And if your donkey suffers shifting lameness and altered behaviour, the tick-borne condition Lyme disease is something to consider, especially if you live in a tick hotspot. You can Google this and find maps of where the ticks are present in the country. Hoof abscesses, otherwise known as pus in the foot, are common and they're really painful. This is the hopping lame donkey. A tiny piece of grit lodging either in the white line or having penetrated the sole can be the start of an infection. If the original entry point closes over, the infection becomes trapped. In cases of white line abscesses, the infection can track up the white line, which is naturally softer horn than the wall of the hoof, and may eventually burst out at the coronary band, but not before many days of intense pain, so we really don't want to see this. Now, why are these abscesses so painful? After all, it's very similar to a boil, which can be uncomfortable and cosmetically devastating, but not cripplingly painful. Well, the thing about a boil is that it can swell outwards, so it doesn't put pressure on the sensitive tissues around it. When pus is accumulating but trapped within the hard hoof wall, it can only swell inwards, so causes extreme pain due to the pressure on tissue that is well supplied with nerve fibres that interpret the pressure as pain. Sometimes less intensely painful, but usually more sinister, are solar abscesses, as the infection can spread to the pedal bone and other tissues in the limb, and it's incredibly difficult to clear up bone infections. Recourse to surgical intervention is sometimes necessary. The infected bone would literally be scraped away under anaesthesia, with no guarantee of success and an awful lot of aftercare. And while we're talking about abscesses, it's worth mentioning that if your donkey is unlucky enough to step on a nail, you should not pull the nail out. If you can bandage on a donut dressing which surrounds the nail but keeps the pressure off it while the donkey weight bears, that is ideal. Call your vet immediately, who can x-ray the foot to see exactly how far the nail has penetrated and whether any vital structures have been affected. If the nail falls out, then do mark the entry point quickly before it disappears to help your vet probe the site. A magic marker on a dry sole works really well. On the left is a hoof with several black defects in the white line, all of which would need to be probed to find out which one is the tract that requires draining. These solar abscesses in the middle and on the right are very obvious and very worrying. Clean the hoof thoroughly to find out what you're dealing with. Hot tubbing can help if your donkey is compliant. Around 10 minutes in some hand-hot salty water may just draw out the pus. It will feel like a lifetime, but it's worth a try. Dry the hoof and surrounding hair. Apply a poultice to the area you've identified and ensure your final dressing is waterproof, as a soggy bandage does more harm than good. In the case of a solar abscess, you should call your vet quickly, as early treatment can reduce the risk of subsequent pedal bone infection. In any event, you need to get some pain relief on board, as these abscesses can be so painful that the donkey stops eating, and this can quickly lead to hyperlipemia, which, as you know, can be fatal. A common painkiller is phenylbutazone, bute, given twice daily. Remember, donkeys are different from horses and require twice daily dosing. Miniature donkeys need 3 times daily dosing. If the abscess doesn't clear up, the vet can take radiographs, x-rays, to precisely locate the infection and also establish if the pedal bone or other tissues have been affected. It's really rewarding to see the pus draining. It may be grey, black, cream, or even clear in colour, and the donkey will feel better very quickly. It's really important to keep the hoof clean, as the drainage hole will be susceptible to further insults, so keep a dry dressing on the hoof for a few days to make absolutely sure no more pus is coming out, and then you can apply a sugardyne dressing to harden up the hoof. This is a cheap and effective mixture of iodine and granulated sugar to make a gloopy mix which is antimicrobial. It's also very delicious though, so do keep it out of reach of your donkey. It's for dressing, not eating. A recipe and guidance on dressing a hoof can be found on the Donkey Breed Society website under Education. Finally, one abscess, well, that's bad luck, but repeated abscesses could be because the hoof is diseased. Maybe the white line is stretched, and a major cause of that is what we'll talk about next. Laminitis, very common, often unrecognised in our stoic, non-exercise donkeys, painful and can be life-limiting. Laminitis can affect 1, 2, 3 or all 4 feet, and there are 3 main causes. Generalised infections such as colitis, placentitis, sepsis. Supporting limb laminitis, a result of excess pressure on one limb to compensate for a limb injury, usually in the opposite limb. And then we have the most common cause, which is endocrinopathic laminitis, also called metabolic laminitis, and it's all down to the hormone insulin. You may be thinking, why haven't I mentioned the breaking into the feed store or access to rich grass as a cause, but actually this is also down to insulin. Insulin is a hormone secreted by the pancreas in response to sugars in the diet, and it converts those sugars to energy. However, in what we call insulin dysregulation, an excessive amount of insulin is released, and this can lead to laminitis by a mechanism we don't completely understand yet. Donkeys with equine metabolic syndrome or Cushing's disease, both of which affect insulin levels, are at risk of laminitis, as are those that are overweight. Equine metabolic syndrome is the equivalent of type 2 diabetes in humans. And that donkey that finds his way into the feed store or the sugary grass field can take on a load of sugars, leading to an insulin spike that can trigger laminitis. To understand what happens in laminitis, we need to know the anatomy of the foot. The coffin or pedal bone, also called P3, is suspended within the hoof capsule by what we call interlocking lamellae or leaves. The hoof wall has around 550 insensitive lamellae projecting inwards to meet a similar number of sensitive lamellae, otherwise known as laminar corium, that are firmly attached to the pedal bone, are extremely sensitive, being well supplied with nerves, and project outwards to interdigitate with the hoof wall lamellae. The total surface area of the lamellae is around 0.8 square meters, which is about 6 sheets of A3 paper. Huge when you think of the size of the hoof, but that massive surface area is necessary to suspend the coffin bone within that hoof capsule while carrying the weight of the donkey. Think of it like Velcro. It's well nigh impossible to separate 2 pieces of Velcro by trying to slide them apart. And here's an illustration of the changes that occur when laminitis strikes. the lamellae become inflamed and less effective at holding the pedal bone in place. The forces that take over result in the pedal bone both sinking within the hoof capsule and also rotating, as the compromised Velcro is now being pulled apart as the Velcro tears. Think about how easy it is to pull Velcro apart as opposed to trying to slide it apart. And you'll see that the white line will be widened, which can leave the hoof more susceptible to subsequent abscesses. And here is the tragic consequence of a severe bout of laminitis. The pedal bone has actually come through the sole of the hoof, and there's really no way back for this poor animal. The donkey doesn't usually adopt that classic laminitic stance seen in horses, rocking back on his back feet, but instead chooses to lie down to take the weight off the painful feet. He may weight shift from one foot to the other while standing. He may well be short-strided with a shuffling gait. In long-standing cases of front foot laminitis, the donkey has spent so much time concentrating the weight on the hind limbs that the muscles of the front limbs waste away, and this is what you can see in the picture in the middle. The picture on the right shows telltale signs of laminitis, with ridges going around the hoof which angle downwards towards the heel, because the hoof growth at the front of the hoof is compromised, so grows more slowly than the horn towards the heels. Laminitis tends to recur, so you need to be very vigilant for any signs of foot pain. Here are some more x-rays, one of a normal foot on the left, and you can see the coffin or pedal bone is parallel to the front of the hoof wall, which is marked by the red line. The red line is actually a metal marker which is always placed with the top end at the level of the coronary band, so we can measure if the coffin bone has sunk. You can see in the normal picture on the left that the top of the red line is just above the top of the coffin bone, which is normal. However, in the laminitic x-ray, the top of the coffin bone has clearly dropped downwards and has lost the parallel relationship with the hoof wall. This is sometimes called founder, and the donkey is said to be foundered. It has also lost its normal shape, and the bone is actually demineralized because its blood supply is now severely compromised. This is nothing short of a disaster, and it's doubtful whether this donkey's pain could ever be controlled. And as they only walk on a single digit, they have no backup plan. To have any hope of saving the donkey, the vet should be called urgently. Pain relief will be given, and the donkey must have box rest to allow time for those inflamed lamellae to heal. A deep shavings bed is best, and sole supporting dressings can be applied with a thick layer of cotton wool supporting the whole sole. Frog supports should not be used in donkeys. Their anatomy is different to that of a horse, and a frog support could actually make things worse. Make sure the donkey can easily access his feed and water. The vet will probably want to take blood samples to see if there is a hormonal imbalance that can be treated. The remedial farrier can do wonders to help with foot comfort, but he will need x-rays to work to. Not even the cleverest of vets or farriers can see what's going on within the hoof without the benefit of those x-rays. Once the cause has been established, you can take steps to prevent a recurrence. This may be medication for hormonal disturbances, making sure the donkey loses weight, altering the diet, whatever your vet recommends. You may have heard the old adage, no foot, no horse. Well, it's just the same for the donkey. Just bear in mind that your donkey's quality of life is what matters, and you may need to make a difficult and sad decision in his best interests. Keratomas are benign tumours and not very common, but something to bear in mind with a lameness that comes and goes and no abscess can be found. Easily diagnosed by X-ray. On the left you can see a subtle indentation in the pedal bone, and on the right an unusual case of 2 keratomas causing large defects in that bone. The only treatment is surgical resection of the tumour, which involves removing the hoof wall overlying the lesion, so healing is quite a lengthy process requiring diligent aftercare. Arthritis, inflammation of the joints, is always painful, usually progressive and downright horrible. Please check your donkeys regularly for ease of movement and keep a diary of how often they lie down. All donkeys need to lie down for a good deep sleep for at least 2 to 3 hours a day. But as a prey animal, they also need to be able to get up quickly and easily to run away from a predator. Now, if they find lying down or getting up painful, this really impacts their quality of life. And eventually they may stop lying down altogether because they fear they won't be able to get up. Donkeys and horses can nap while standing, but they cannot sleep deeply. So they will soon suffer sleep deprivation if they can only stay standing. And the arthritic donkey may no longer be able to negotiate your steep field. The X-ray on the left is normal, and on the right you can see the extra bone that has formed around the pastern joint. Unlike horses, donkeys seem to get arthritis in the upper limb joints, elbow, shoulder and hip, and these can be much more difficult to image in the field. I think it's safe to assume that nearly all aged donkeys will have a degree of arthritis. Managing arthritis is all about the pain. A painkiller trial prescribed by your vet is really useful. If the painkiller results in an improvement in mobility, then you know that your donkey has pain that needs to be managed. Your vet may prescribe phenylbutazone, cartrophen or carprofen, and some feed supplements containing glucosamine, chondroitin and hyaluronic acid claim to ease the symptoms. I have put up a link that you may find interesting, but this is not a recommendation from me as your donkeys aren't under my care. It's simply for your information. Please always consider your donkey's quality of life. One thing about arthritis, it is highly unlikely to get better and very likely to get worse. And if your donkey is having more bad days than good, it may be time to make that hardest of decisions. Hardest but kindest. Just a quick mention of the locking patella or kneecap. As you know, donkeys can doze standing up, and to do this, they lock their back legs into a fixed, straight position so they don't fall over, thus avoiding huge embarrassment. It's a bit like a hook and eye system, and the technical term is the stay apparatus. Now, the stifle's a very complex joint, and the diagram is just there for your interest. The donkey needs to maneuver the eye over the hook to release the fixed position, but can only do so with strong leg muscles. The video shows a donkey dragging the back leg in a fixed position, unable to unlock the stay apparatus. It can happen in one or both back legs, and a youngster may well grow out of it as he develops stronger muscles. If not, there are some exercises you can try, and the exercise protocol is on the Donkey Breed Society website under Education. A last resort is surgery, so do speak to your vet if you're concerned. And finally, here are some of Safe Haven's rescued donkeys having a good run in their fabulous new sanctuary in the West Bank. Laminitis and obesity are rare in Israel and the West Bank. As you can see, there is no grass, and that greatly lowers the risk. They just have straw to eat as long as their teeth are good, and that is what your donkeys should be having as their main diet. By keeping a close eye on your donkeys and watching out for any changes that may be very subtle, you can quickly get control of any lameness problems and keep your donkeys healthy and happy for a long time to come. Thanks for listening.